Hello, my name's Martin Gray. Welcome to Healthy Hands, Wrists, and Forearms. If you're a musician, typist, massage therapist, carpenter, or anyone else who works intensely with their hands, you're surely aware that your hands are your most important tools. But while it's essential to keep those tools in good condition, research has shown that many people regularly complain of weak, stiff, aching hands. The most common methods for dealing with these ailments are struggling through the pain, uneducated attempts at massaging the hands, and hope that the condition will eventually pass. But sad to say, the painful conditions usually don't stop and only get worse over time. Yet the problems of stiff, sore, and weak hands can easily and quickly be treated through a simple hand and forearm conditioning program, which I call Healthy Hands. Combining self-therapy massage techniques with a variety of strengthening and flexibility exercises, the Healthy Hands program produces strong, flexible, pain-free hands and forearms. The Healthy Hands exercises are simple to learn and take only 10 minutes or so to do. And in addition to their healing and strengthening benefits, the exercises also develop an increased sensitivity in the fingers and the hands. I developed the Healthy Hands program based on 20 years of helping people with chronic hand and forearm problems. I've been a yoga teacher, a dancer, and a juggler with a background in exercise physiology, kinesiology, and massage therapy in the Healthy Hands video. I'll share the insights and techniques I've learned from healing and strengthening my own hands and also hundreds of other people's hands. You might ask how I learned these wonderful exercises myself. That's a good question. For several years before developing the exercises, I'd been a massage therapist specializing in the treatment of other people's muscle and tendon injuries in their forearms, hands, and fingers. From all of this hard work, however, I began to experience pain in my own wrists and hands. I wondered what to do about this, so I asked some orthopedic surgeons and sports medicine doctors what to do. Upon hearing that I did strenuous massage for several hours a day and also juggled for another hour or more, each of the doctors said my pain resulted from what they called overuse syndrome. They recommended that I limit the amount of hard work I did with my hands, but that advice didn't work for me since I made my livelihood from working with my hands. So I decided to try another approach to free my hands from pain. That approach was to increase the flexibility and strength of my hands and to begin a consistent program of self-massage of my forearms and hands. I also undertook a study of the anatomy of the lower arm in order to better understand the precise location and causes of my pain. Within 2 months of beginning these practices, my wrists and forearms were entirely free from pain. Next, in order to fully gauge the effectiveness of my approach, I began to teach the exercises and massage techniques to other people who also had worked with their hands. The results were extraordinary. Dentists and musicians, surgeons and sculptors, massage therapists, and many other people who made their living with their hands all experienced rapid and lasting benefits from doing the Healthy Hands exercises. Besides alleviating their pain, these people also told me that the exercises increased the flexibility of their hands, which gave them an improved ease and efficiency of movement, whether it was for piano playing, dental surgery, or lots of other things they did with their hands. Hearing that really excited me. The Healthy Hands exercises you're about to see are the result of years of experience treating the aches and stiffness of my own hands and also those of hundreds of my massage clients. Combining self-therapy massage techniques with a variety of strengthening and flexibility exercises, these exercises produce strong, flexible, and pain-free hands and forearms. The exercises are easy to learn, and they take only a few minutes to do. Besides their strengthening and healing effects, these exercises also develop increased sensitivity in the fingers and hands. The Healthy Hands exercises presented here were photographed using video cameras located at different angles relative to my hands. Because of these different camera angles, each of the exercises and therapy techniques are clearly demonstrated and simple to follow. Now let's begin. Now we're going to begin the stretching exercises, and during these I'm going to use my right hand to work on my left, and then I'm going to use my left hand to work on the right. And since there's many different exercises that we're doing, we'll do right to left and left to right on one, and then we'll go and do the same thing on the next one. So the first thing we're going to do is use the right hand to pull the left hand backward. And while one is doing this, you're not really forcing it, you're just holding it into a certain position and you're relaxing in there. And there's a tendency for us to sometimes tighten against this. You want to not let that happen. And if you feel that's happening, just allow your concentration to go there and soften and release and relax. So now I'm using the right hand to pull the left hand backwards. And now we'll do the same thing with the left hand, pulling the right hand backwards. And it's only necessary to hold these stretching exercises for each hand for 5 to 10 seconds. So what I've done here is using both hands to pull the opposite hand backwards. Now what we're going to do is we're going to pull the hands forward. So right hand is going to go on top of the left hand, and I'm using the right hand to pull the left hand down. Again, I'm not forcing it. And so you hold this for 5 or 10 seconds, and again, do not resist it. Try to keep your left hand very soft and relaxed. Now I'm pulling the top of the hand down. Now watch how I bring my right hand down to the fingers and I pull them down and pulling them in towards my left wrist. And then I'm going to do the same thing with the left hand, pulling the right hand down. Again, I start on the top of the hand and I'm pulling it forward, pulling it down to my wrist. And I hold that for 10 seconds or so. And then I allow my left hand to slide down onto my right fingers and I pull them in. Now what we're going to do is we're going to work on our thumbs. So first I'm going to use my right hand to bend my left thumb backwards. And again, just holding it 10 seconds. And we're not forcing it. And over a period of weeks or months as you're doing this, you'll notice that you become much more flexible. But if you resist while you're doing this, the body will just tighten up. Now we're going to use the left hand to do the same thing, pushing the right thumb backwards. And one wants to notice what's happening with the fingers. They shouldn't be tight. Everything is relaxed, and we're just using the left hand to bend the right thumb backwards. Again, holding it around 10 seconds. Sometimes in the video here, I'll hold it a little bit longer so you really get an idea of what I'm doing. Now what we're going to do is we're going to bend the thumb forward. And you could hold it like this or you could hold it like this, but what we're doing is gently moving the thumb forward. Before we've been doing it backwards, now we're going forwards. And again, the fingers of the hand, they're just relaxed. There's not much attention placed into them. And you can see I'm using my right hand to bring the left thumb forward. So then we use the left hand to do the same thing. And I catch the thumb with this other thumb. As you can see, I could do it this way. I do it this way, and I have my fingers behind. And again, just 10 to 15 seconds, no problem. And then one could do it again. The right hand being pulled back, the left hand being pulled back by the right hand. And then the right hand being pulled back by the left. And then to go over it again, we're using the right to push the left hand down, and then left fingers down and inward. And the left hand on the top, pulling the right hand down. And then the right fingers down. And now what we're going to do is we're going to turn the hand. So I'm going to use the left hand and I'm going to turn it this way with the thumb pointing down. Then I'm going to use the right hand and reach this way where I can accentuate the turn. So again, I'm turning my left hand out, putting the right hand here, bending it a little bit forward. And then what I'm going to do is go in circles to both directions, in both directions. And you just do 5 or so circles going in one direction, and in 5 or so circles going in the other direction. And now what we're doing with the right hand, we're going to do with the left hand. The right hand turns out, and the left hand reaches around and gets it a certain way and turns it even more. We're turning our wrist here. And then again, as it's in that turned position, we take both our hands, using our arms, to go around in a circle in both directions. Now we've turned both hands out that way. Let's turn them in this way. So I'll turn my left thumb down, and I put my right hand on the top, and I turn it a little bit more. And then again I do these circles, going in both directions. And we don't want to be going really quick. We want to be going quite slow. And so we really feel what we're doing inside of this left wrist joint. And again, going in both directions. And I recommend doing it about 5 circles in either direction. And again, noticing if there's a tendency for you to tighten up somewhere and resist it, and then trying to soften and let go. So now what we're going to do is turn the right hand in, the left hand goes on top, turns it a little bit more, and again we go in those circles. And whether you start with the circles going forward or the circles going backward, it doesn't really matter, but what you want to do is circles in both directions. The next thing we're going to do is we're going to spread our fingers apart. And we're going to use one hand as a sort of spreading mechanism to help the fingers be spread apart. So what I'm going to use is my thumb and my little finger, and I'm going to place them between my other fingers, and I'm just going to pull them apart, just stretch them apart. And while you're doing that, one of the things you can do is use these fingers and push on the back of the hand. And so they're being pushed apart, the fingers are being spread apart, they're being pushed back, and then what you can do is wiggle your hand like that, or use the other hand and wiggle them both. And this really works on the joints right here. So then you use this spreading mechanism for each set of fingers. So I spread the fingers apart, then I bend them back, and then I wiggle them just a little bit like that. And again, this only needs to happen for 5 to 10 seconds. And you do each set of fingers. Spread them apart, bend them back, and then wiggle them. And you can also do the first finger and the thumb, same spreading mechanism, same everything about that. Spread the thumb and the first finger apart, move them back, and then wiggle them. Now remember, everything we do to the left hand, we're going to do to the right hand. So put that spreading mechanism of the left hand in between the first 2 fingers, spread them apart, push the fingers down on the back of that right hand, and then wiggle the hand. So you're actually getting 2 stretches at the same time, spreading the fingers apart and bending the back, and then you're wiggling it. Again, it's only necessary to do, let's say, 10 seconds on each hand. And then we do each set of fingers. And again, I'm using one hand as a spreading mechanism. I fit it inside between the 2 fingers. I spread them apart, and then I bend them back as I wiggle. And we do each set of fingers. And then finally, the first finger and the thumb. Now the next exercise, we're going to put each one of the fingers in traction. And the way we're going to do that is I'm going to use my right hand, and I'm going to gently, it's very important to gently do this, I'm going to hold the left thumb and just put a little bit of pressure pulling it forward. It doesn't have to be a lot of pressure, just a little bit, to put these different joints in a sort of decompression. And then what I'm going to do is use the hand that's pulling just to wiggle that finger around. So I'm putting it in decompression, I'm putting it in traction, and I'm moving it around, which is sending that traction into different parts of the joint. And you do that on each finger. Again, the right hand pulling on the finger. And if you pull from the very base of the finger, then you're going to put all the joints in traction. If you just pull here, it's not going to work these 2 joints. So I kind of hold it at the end, and I put it in traction, and then I spin it around in circles in both directions. And you do each one of the fingers. And again, you don't want to be pulling so hard that it hurts. And you need to understand that you're not trying to get benefit from these exercises in one day of doing this, but you have a program of doing this for, I've been doing this twice a week for years and years and years. And so again, I work each finger on the left hand by putting it in traction with the right hand. And then I'm going to do the same thing with the right hand. Use the left hand to put the right thumb in traction, put it in traction, and then wiggling it around or spinning it around. Another thing you can do while it's in traction is you can turn the hand like this. And one of the things I'd like to encourage you to do is once you hold these movements, then explore them, experiment with them, and you'll probably find different ways to do them than I'm doing them, and ways that are appropriate to your own hands. So now I'll use the left hand to put the right finger in traction, and again I'm pulling from the end, but I'm holding the entire finger. So now I've got all of these joints in traction, and I can even move the finger around in this way, or I can just use the right hand, or I can use a combination of both. And then the next finger. And one thing I like to think of while I'm doing this is my hands are both sort of living beings, and my left hand is talking to my right or assisting it, and my right hand is talking to my left. They're not really separate entities. They're both parts of me, and there's a consciousness of my left getting permission from my right and my right getting permission from my left, and them helping each other. And it's really nice when you understand that. So again, I'm just pulling on that second finger, and it's not a lot of pressure. It's very gentle. It doesn't hurt. And if you notice while doing this, your jaw tightens up or your face tightens up, you can release them, you can relax them. And these actually become a very good physical meditation, because the only place that we really want there to be resistance is in our hands. The rest of our body should be quite relaxed. And again, once you put the finger in traction, you can go around using the left hand to move it, or you can turn the right hand. And then finally the little finger, and same thing. Now sometimes I'll do it this way. I'll use the right hand pulling this way rather than this way, and you can experiment with that too. And I grab the whole finger and I just pull. And then what I do is I notice there's a certain relaxation while it's happening. I don't resist, I'm letting go. So I'm creating the traction, and then I'm relaxing into the traction. So again, you work each finger. And when you initially start the pull, there may be some resistance, but maintaining the pull, then what you can do is soften into the traction, and that's where the benefit really occurs. Because if you're tightening up against it, you're really not getting the traction. And if you pull too hard, then there's going to automatically be some traction. So it's really a gentle amount of traction. And then you can wiggle these too at the same time. Again, please be experimenting with your own hands. And you do each finger on both hands. And so see, I'm pulling with my left hand on my right finger, and then I can turn my right finger. And I can use my left hand to turn my finger in the opposite direction that I'm turning my hand. You'll see there's a lot of variety that you can do here. And as you practice more and more variety, you're going to become more and more in touch with your hands. And I have to say that your hands are going to appreciate it. And again, you do each finger. And sometimes I'll do it a little bit longer than I suggest you do it, and I'm doing that here on the video so you can really clearly see what I'm doing. And again, you do each finger. Now what we're going to do is we're going to compress each joint very, very gently. So I'll use the right hand to squeeze each joint on the opposite finger, opposite hand. It doesn't have to be hard. It's just a little bit of a squeeze. And you do each joint. There's 3 joints on each finger. And again, it doesn't have to be held long, and certainly not intensely. Just a little bit of a squeeze. Using the right hand to do this on each of the fingers of the left hand. Now for some people this will be a little bit painful, but if you persist in doing this, again without too much pressure, if you persist in doing this over a period of weeks, you're going to find that the resistance and the pain goes away. But the resistance and the pain will increase if you do it too strongly. So what I'm saying is be gentle with yourself here. Don't try to make the flexibility happen too soon. It's very, very important. Always have patience with this. Sometimes it took years to get the injuries or the tightening or the soreness that you have in your hands, so don't expect to get relief from that just in one day or 1 week. No, take the time. Have patience with yourself. So again, now I'm going to use the left hand to work on the right hand. Everything I did with the right hand on the left hand, we repeat it here. So, left hand is squeezing each one of these joints. And the order in which you're doing this is not important. You could work the left hand working on the right first or the right on the left. And you could start at the top joint going joint 1, 2, 3 or the other way around. So let's see that. I'm doing the first joint and then the second joint. And you'll see how I'm kind of squeezing it a little bit here. Again, very gently. And the neat thing about all of these exercises is you could be sitting on a subway train and you could just do this. You could be in your car, you could be sitting on a park bench, you could be out camping, sitting around the campfire, and you are just working on your hands, massaging your hands, taking care of them. And again, they will really appreciate this. Now what we're going to do is we're going to squeeze different parts of the hands. I'm going to use the right hand to squeeze both sides of the left hand together. And with the left hand, I'm not resisting it. I'm just squeezing. You can see how I'm doing it. I'm using the right hand to squeeze these two parts of the left hand together. And the same thing, using the left hand to squeeze the right hand together. And another one is you kind of make a fist, not really tight, a fist like this on my left hand. Then I use my right hand, and I'm going to try to sort of squeeze my fist so it makes it, I squeeze it and I kind of take it out of this circular, spherical position. And the left fist, even though it's not trying to resist, just because it's maintaining its form, there's a subtle resistance to what this hand is doing, and there'll be a building of strength there. Now I'll use the left hand to do the same thing, squeezing both sides of the hand together. And while you're doing it, let the right hand be soft and relaxed. It's not resisting it. And you'll notice I squeeze and I don't squeeze and hold it. I'm actually massaging it while I'm doing it. Again, we repeat everything we've done on one hand on the other. So I've made a fist and I'm squeezing. Now, a really important joint to work is the one between the hand and the forearm. There's two bones here in the forearm, and where they join, these are called the carpal bones here, but you'll find there's a ridge all the way around. So what I do is I make sort of a grabbing mechanism here, and I'm going to squeeze in all the way around this ridge on my left hand. And I'll use my fingers and really try to find that ridge. Sometimes you won't find it because the hand is in a certain position relative to the forearm. So I'll move it around till, that ridge is exposing itself. And then I'll press in there and I'll wiggle in there. And again, sometimes you'll do that and you'll go, oh, that hurts, that's very sensitive. So what that means to me is keep doing it, but doing it with less pressure. And also doing it with the understanding that I'm not in a hurry. If this takes a couple of months until the pain goes away and it gets more relaxed, that's fine. Again, don't be in a hurry. And one thing you can do is holding it tightly like this and then turning the hand like that. And when you're doing this, what's in a sense happening is because I'm squeezing in here, I'm creating an expansion of the hand pulling away from the wrist. So in one sense, what I'm doing is I'm increasing traction between these two body parts while the body parts go in circles relative to one another. So what we did with the right hand on the left, now we'll do with the left hand on the right. Start finding that ridge. And to find that ridge, it'll be necessary to move the right hand around so it's bending in one direction, which will a lot of times reveal that ridge. And so you just become familiar with yourself, finding this ridge all around, and really 360 degrees you can find it. So you're just squeezing in there and not too intensely. And if you wanted to use some lotion here on your hands while you were doing this, that's fine. And then squeezing in pretty intensely And in doing this with your fist, because again, what we're doing is we're creating attraction. We're making the hand go away from the forearm by squeezing into that ridge in there, that opening. Then another one that you can do is interlace your fingers like this, okay? Interlacing the fingers and getting them as close as you can, and then squeezing your hands together. And by pulling my wrists together, the bottom of my hands together, what it's going to do is put these joints in traction. And then what I do is I again take the hands in circles going in both directions. And while we have our hands together like that, what we can do is use each hand to squeeze the inside of each finger. So each finger is squeezing in here. So you squeeze them, and then while you're squeezing them, you wiggle it like that. And so in a sense, you're massaging inside of each finger, and you're using each finger to massage inside of the opposite hand. So I'm just squeezing in, and then I'm just wiggling my hands. Well, we have 3 sets of joints there, so we have the space inside of 3. Let's go to the next space. Do this with your fingers, squeezing, and then wiggling them, rotating them. For that final digit, what I found the best way to do it is turn my hands like this, rather than like this, like that, and I position each one of my fingers, and again I squeeze them forward, and I put my thumbs on the top, and I'm squeezing pretty hard, and then I wiggle again. And then what you can do is right on the cuticle with each finger, you can hold it down, use one of the fingers between the finger and the thumb, and squeeze it in and then rotate. A neat thing to know about this is a number of the acupuncture meridians come down and they end at this place on the body, on the hands, and the end of the acupuncture meridians are a really good place to do massage. So each time I'm using the right hand to work that area between the fingernail, at the top of the fingernail, at the cuticle, I'm squeezing it in and I'm just turning the hand backwards and forwards. And you do each one of these. And again, it doesn't have to be done long. 5 to 10 seconds on each is fine. And you do each one of the cuticles, each finger. And as you do these more, you'll become familiar with your hands and you'll find ways that work particularly for you. It doesn't have to be exactly like I'm doing it, but I just want you to get the idea. And for the first number of weeks that you practice this, I'd suggest that you watch the video. You sit in front of your TV. You can have music going if you wish, or listen to my voice. Sometimes it's not even necessary to have the voice, just to watch. Just to watch what's happening and explore your hands. And one thing I often think of is my hands are expressing gratitude to each other. So again, just going back over some of them again, we're bending one hand backwards and then the other backwards. Bending one forward, again, hand on the top of the other hand, and then coming down to the fingers, bending it inward. And whatever we do, right doing to the left, we use the left doing to the right. Now, the order in which I'm doing this is also not important. You can switch it and do whatever order you want. And if you feel one exercise is particularly necessary for you, you can do it more. And the neat thing is about this, you could be in an elevator riding between floors. You can do this so many different times. And again, spreading the fingers apart and wiggling the hand. And after a while, you won't even have to look at it. You'll see I've got my eyes shut now. And it's all about feeling. One of the wonderful things about these exercises, again, they increase the sensitivity of your hands. And also a neat thing about them is, let's say you're an oboe player or a guitar player or a piano player, because you've taken care of your fingers and you've increased their flexibility, in their dexterity, in their sensitivity, I guarantee you, you're going to be able to play those instruments better. And from having taught a lot of musicians these exercises, I watch beginning musicians, and when they're playing, their hands are very tight. But if you watch someone who's been doing it for a long time, the hands move effortlessly over the keys or the frets. Same thing. If you do these movements quite a bit, your hands are going to become very relaxed and you'll be able to do whatever movement you do with them. Imagine you're a dental surgeon and you've got some sort of implement in inside of someone's mouth. You want your hands to be very relaxed so you don't move and you hurt them. So what we really want to do is relax our hands while we're doing these movements. Oh, and another one that I oftentimes do, because we've pulled the hand back, well, watch this one. What we could do is just bend the fingers back. So I'll put right hand underneath the left fingers, pushing up, and then I'll use my right thumb to push down. So what I'm doing is I'm sort of making a circle, a bowl, in my left hand. I'm bending the right fingers back, not the whole right hand, but the right fingers back, and it's really quite relaxing. And again, if you feel some tension in the beginning or your fingers feel kind of straight, and I've shown this to many people and they go, my fingers won't do that, they're locked, they're too straight. But then they do this for a few months and they come back and they see me and they go, look at the progress I've made. My fingers have become like plastic, like putty. Whatever you do on the left hand, do it on the right. And again, I'm being gentle and I'm moving around, and it's as if the hands are having a communication, a conversation with each other. So that's a good idea. We've done a whole lot here to work on our hands, increase their flexibility, and there we go. The next set of exercises we're going to be doing are strengthening the hands and the forearms. Now, when you think about strengthening, strengthening is oftentimes one muscle resisting pressure or resisting weight. And if you went into a weightlifting gym, you'd get a barbell or a dumbbell. So I've got a 2-pound weight here. And if I wanted to work on the extensor or the flexor muscles are here and extensor muscles are on the back, I could lift this weight up and down. Well, if you wanted to do these exercises while you were on the airplane, or you wanted to take a vacation, or you wanted to do them at work, to always have to carry one of these around is kind of a problem. So why not use one hand to increase the resistance or put resistance on the other hand? So what I'm going to do is I'm going to place my left forearm on my left leg like this and just hang the right hand off of it. Now there's this range of motion you could have with your left hand. That's the range of motion. So let's do that range of motion with resistance. I'm going to put my right hand on top of my left hand, and then the left hand is going to pull up while the right hand resists. Then the right hand pushes down while the left resists. Left up while right resists, right down while left resists. So I'm just going up and down, and there's this constant resistance between the two. Left is always pulling up, while right is always pulling down. And this is working the extensor muscles on the back of the forearm. Left up, right down. And there's resistance through the full range of motion. That's really important to understand. Resistance through the full range of motion. And again, like we did with the flexibility exercises, whatever we do on the left side, we do on the right. So now I'm going to work the extensor muscles on the right forearm. I put the left hand on top of the right hand. And again, I take that range of motion of the right hand, and I'm just putting resistance against it. So now we have the right hand pulling up while the left resists, and the left pulling down while the right resists. And again, what we have is resistance through the full range of motion. There's not a single second where you stop that resistance. The resistance doesn't have to be heavy. The resistance is only such you can feel it. And over a period of time, you're going to find your strength builds up. So now we've done the extensor muscles on the back of each forearm. Let's do the flexor muscles on the inside. And this would be like doing this with a weight. So I'm going to, again, base my arm on my leg. And the reason I'm doing this and not holding it up like this is because then my deltoid muscles would be holding my arm up. I want the muscles in the rest of my arm to be relaxed. So I base them on my knee, and here's that range of motion again, left hand going up and down. I'm just going to put the right hand on top, put some resistance, then left pulls up while right resists, right pushes down while left resists. And you just go back and forth or up and down. the left pulling up while the right resists, and the right pushing down while the left resists. And notice the speed that I'm doing this at. You don't want to go any quicker than this, because if you're going quicker than this, it's difficult to sort of be present with and maintain concentration with the constancy of the resistance. That's what we want, is resistance through the full range of motion. What I had done with my left hand, now I do with my right hand. Exact same movement. Put the left hand on top of the right hand, and I just have the right hand going up and down while the resistance is placed upon it by the left hand. And again, we have the resistance going through the full range of the movement. If you go into a weightlifting gym and you watch good weightlifters, you'll notice that oftentimes they only do a movement, a particular late weightlifting movement, 10 to 15 times. You don't need to do more than that. Same with your wrists. So now we've done the flexor and the extensor muscles, so now let's do backwards and forwards like this. So what I do is I'm going to just interlock my fingers, and again, you really need to have your arms on your legs like that. So now the right wrist is going to try to pull up while the left wrist is resisting, then the left hand pulls down while the right resists. So right is up, left is down. Right pulls up, left pulls down. Right up, left down. Right up, left down. Then keeping our fingers in the same position, now the right pulls down while the left resists, and then the left pulls back up. Right pulls down while left resists, left up while right pulls down. So what we have here is the right trying to go down and the left trying to come up, and they're resisting each other and pulling against each other, and there's that resistance again through the full range of motion. That's really important to understand. Resistance through the full range of motion. Now what we're going to do, a lot of times people are squeezing things. Their hands are very strong to squeeze, but there's very little emphasis opening the fingers up. So I've got this really interesting way of doing it. I'm going to take the fingers of my left hand and make them very straight. Then I'm going to make sort of a claw with my right hand and place the ends of each one of my fingers of my right hand on the fingernails of my left hand. So now you can see that the left hand's fingers are straight and the right ones are curled. And I'm going to squeeze in with my right hand fingers, and then I'm going to open up the left hand. Notice the left fingers continue to stay straight. So what's happening here is one hand is opening up while the other hand is squeezing. This hand is much more stronger to squeeze in. So what we're really doing is working the opposite hand as it tries to expand. And again, you only need to do this 10 to 15 times, and there's that resistance through the full range of motion. And we do that on both sides. Straightening the right fingers, the left hand becomes sort of a claw. The ends of each finger in the left hand go right on top of the fingernails. We squeeze in. And in the right hand, right fingers are trying to expand outward, keeping them straight. We don't want them to bend. We want those fingers to stay straight. Now this takes a little bit of coordination and a little bit of practice, but after you get that, it really actually it's quite enjoyable. This one's quite nice to experience. Now we did a flexibility exercise in the first part of the video where we were just squeezing our hand without actually having resistance here. Well, now I could squeeze it, and then I could try to open this hand. And there's so many different muscles in the hand that we're exercising here. So I'm squeezing here while I'm resisting it and trying to open it up. Same thing on the opposite hand. Now, one of the important things to understand about this is, let's go back to here. And there's this movement of my hand. If I was to put a dumbbell in my hand and I'm doing this, the dumbbell always weighs the same amount. Let's say I put a 5-pound dumbbell in here. Well, my wrist, my extensor, my flexor muscles are strongest right there, but at the beginning, at the end, they're weaker. With a dumbbell, you can't have it weigh 3 pounds, 5 pounds, 3 pounds, 5 pounds. But when I put my other hand on top, I can regulate the amount of resistance. So what this is a fluid isometric exercise, because the dumbbell is actually, in a sense, sort of dumb. It has no intelligence. It can't regulate the amount of weight that it has. But here, this hand consciously can regulate the amount of resistance it's giving to the other hand. And you can do this on each one of the exercises. So again, we've worked the flexor muscles, the extensor muscles, and then the hands going up and down. And again, that one's really quite simple. The fingers stay interlaced the same way. It's right pulling up while left resists, the left pushing down while right resists. And you just go up and down while the right is pulling up, the left is pushing down, keeping the hands in the exact same place. Now the right is pushing down and the left is pushing up. And then that movement, again, the fingers of one hand are straight, the fingers of the other hand are curled over it on top of the fingernails, and you squeeze in and out. And you do that, whatever you do with one hand, you do to the other hand. And notice the speed that I'm doing this at. You don't want to do any quicker than this, nor much slower, just at this speed. And while you're doing that, feel the rest of your body relaxed. Your shoulders are dropped, your face is soft, your stomach is soft. All of your attention is just into your hand. So those are some really good strengthening exercises for your arms. And again, if you do these for a period of a few months, you're going to notice there's a definite increase in strength in your forearms. Now, why is that important? Imagine you're a tennis player and you got to hold that tennis racket. And every time that tennis racket hits a ball, there's a sort of vibration that comes down the racket. And if you can hold that racket stronger, it's going to be easier to hit that ball. Or you're a bowler and you got to put your fingers in that bowling ball and throw it. And it's good to be able to hold that bowling ball really tightly. So there's so many different applications that you can use with your hands if they're stronger. And a lot of people will go, oh, my hands, they're weak, they hurt. Strengthen your hands, they'll hurt less. Do these flexibility exercises at first to warm up your hands, and after you've warmed up your hands, then do the strengthening exercises. And you only need to do these twice a week. Now, I've taken longer showing these exercises to you in this video, but once you become familiar with the exercises, you could do them with your eyes shut, and you could do the whole program in 10 minutes. It's that easy. Now I'm going to show you some different therapies that you can do on your hands and your forearms. And a really interesting thing about this is you can do this yourself. You could go to a body worker or a massage therapist and pay them to do this for you, or you can just do it on your own arms and forearms and hands. And that's a really neat thing, because let's say you're on vacation and you don't have a massage therapist you can go to, or you're playing some tennis and you start feeling some pain or tightness in your arms and you don't have someone you can go to. You just sit down in a chair like I'm sitting here and you start working on yourself. So I'm going to show you a variety of different things that you can do on your forearms and your hands and your wrists. It doesn't have to be done in a particular order. I would suggest that if you have a pain in a certain area, that you work that area, but you also work the whole area of your forearms, your wrists, and your hands, just to keep them kind of in good shape. So the first thing we're going to do is we're going to bring some blood flow to the forearms and the hands and the wrists. And one of the ways I do it is I'm going to rub my knuckles up and down. Now let's say you got 3 sets of knuckles. The first one's here, the second one's there, and the third one's here. So I'm going to use the second set of knuckles, and I'm going to place it here perpendicular to the muscles in my arm. The muscles go up and down here, the flexors and the extensors, so they're going up and down. I want to place these knuckles perpendicular to it, not parallel to it. So then what I'm going to do is also I'm going to put my left hand down on my knee, so I'm not having to hold my arm up with my deltoid muscle. Just going to rest it there, and so my arm's pretty stable. Then I'm going to get that set of the knuckles, and I'm going to start just going up and down. And what we're doing here is just bringing some blood flow to these different parts of the forearm. And as I'm doing this, I'm going to be rotating the arm. Now, I'm going pretty fast here. You don't have to go really fast, but I'm just moving along like this, and I'm pressing in pretty deep. And you'll notice that the skin gets kind of red. And when the skin is getting red, you know that the blood flow is really coming to that area. And so I'm just going up and down. And again, like we were doing in some of the other parts of the video, where we're doing the stretching and the strengthening exercises, whatever you do to one arm, then you do it to the other. So again, the knuckles are perpendicular to the flow of the arm, not parallel. The hand is stationed on the knee to give us some stability. And then I'm just going up and down on the forearm. And slowly, I rotate the forearm, and I continue to go up and down. And again, you want to have some speed here, so you bring the circulation, blood circulation into the skin, and you'll notice the skin starts to get kind of pink, and that's good. And you rotate the arm just like this. So now we got a lot of blood flow along the forearm. So the next thing that I'm going to do is I'm going to go in much slower and much more deeply. And one of the ways that we're going to do that is I'm going to use, there's 3 different ways actually, I'm going to use my elbow or my forearm of this hand or my knuckles. Now this is kind of inspired by a type of body work called Rolfing or myofascial, and what we want to do is go really deep and really slow along the body of the muscles in the forearm. So there's a couple of 3 different ways that you can do this. One is I'm just going to use the back of one arm, the elbow, and watch how I do this. I'm going to go really slowly down the body of the muscle. And what I'm doing is I'm going in really deep, but I'm not going too quick. And really, really deep. And again, I still have this hand based on my knee, so I'm not having to hold the arm up with my deltoid muscle, and I'm going really slow down the body of the muscle of this forearm. And what we're doing here is we're kind of stretching the muscle. Really slow and keeping it quite deep. Now another way you can do it is I can put my arm like this, and it's really helpful if you're going to do the flexor muscles. So I've just got the arm on my leg, and I'm going to use the part of the forearm of the other one, and I'm just going to go again very slowly. And again, I'm pushing in real deep, real hard, and I'm going quite slow. And what's happening here is imagine the muscle's this long, and by pushing in deep and stretching it, I'm lengthening it a little bit. And the value in that is there's sometimes some tightness, particularly at the tendon attachment. The muscles come into the tendons, and the tendon attachments join at the joints. They fix in at the joints. And so this movement right here stretches everything. In some people's, the body of the muscle is very, very tight. And what this is going to do is by putting this pressure on it and stretching it and lengthening it, it has the effect of softening that tightness of the body of the muscle. And so you see the speed that I'm going at. So it's helpful if you're going to do the flexor muscles, the inside of the arm, to do it this way. You can also use your fist. Now if you wish, you can put lotion on your hands, but if you put too much lotion, you're going to move too quickly. So what we're doing is, again, we're going very, very slowly. And if you look, you can see my fist moving slowly down the flexor muscles, the inside of my forearm. And again, you could do that on the back. You could do it with the back of your hand like that. But I find the best way to do it is this. And again, I'm going really slowly. And as you do this, you kind of stay along one muscle, and then you can move. There's a set of muscles here, then there's a set of muscles there. So what I'm going to do now is I've rotated my left arm a little bit, and I'm very slowly moving my right elbow down. Now the first one we were doing is going up and down real quick and not so deep. Here I'm going quite a bit slower. And really I'm using a lot of concentration, and a lot of times I'll just shut my eyes and feel this. And so again, whatever we do to the left arm, we do to the right arm. So again, I could use my knuckles like this. And see how I'm putting my arm between my knees, because again, what I'm trying to do is have it real stable without having to hold it up, and it doesn't move around, so I've got it between my knees. And I go really slow. And again, you could use lotion, but if you use too much lotion, there's a tendency for the hand to move too quickly along the arm. And what I would suggest is that you do each motion, take, up to a minute to go slowly along. And do it 4 or 5 times for each side, each part of the arm. So you see I just rotate it a little bit, and I again start doing it. You can see the speed that I'm going at is quite slow. And as I said, there's a number of different ways that you could do this. I could use the forearm of the other arm and go slowly down. And you got to experiment on this yourself and find how it works for you best. And one of the ways I like most is to use this part of my arm. And you see what I'm doing? I'm going very slowly along. And again, you'll do one long movement, going down to near your wrist. And then I can rotate the arm a little bit to, another way. And so you're using one arm to work the other arm. And what I'd suggest that you do is, because this is pretty deep work, is I'd use the left arm to work on the right arm, and then maybe a few days later use the right arm to work on the left arm. But remember what you did on each arm so you don't miss anything. So again, what we've done first is brought a lot of blood flow here to the arms, and then we do these sort of rolfing neuromuscular myofascial movements like that. And you could be watching TV, you could be carrying on a conversation with someone while you're doing this. It's also really valuable, again, to do it with your eyes shut, because then what you're doing is you're stationing your mental concentration in a distinct anatomical region of your body. That's really valuable to do. Otherwise, a lot of times people, they don't know where these muscles are, and you don't have to anatomically know what the name of the muscles are, but most people, they don't know what's in here. They don't know who they are here. And so by shutting one's eyes, and you begin to feel yourself really deeply, and you get just a better idea of who you are here. A lot of people think they're just here, but you're here just as much as anywhere else. They're all parts of us. So another thing I'm going to do is I'm going to work the top of the hand. And so what I'm going to do is use that first set of knuckles. I'm going to put my hand on my knee, and I'm going to make sure my fingers stay together. I'm not going to let my fingers come apart. So I'm going to use that first set of knuckles, and I'm just going to rub up and down across the joint, over the carpal bones, the metacarpal bones, and down onto the fingers. And I'm going pretty quick here. And again, if I go down over the fingers and they spread apart, it's not going to work. So you want to keep your fingers together. And so you don't have to rotate the hand so much. You can move the other hand over it like this. Now there's all these little muscles here and turning into tendon attachments. And then you go down over this set of knuckles here, and then up and down the fingers, but you have to keep the fingers together. You can work on the thumb. And you'll notice again the skin is kind of getting red, and this means we're bringing more blood flow into there as we're working the muscles and the tendons along here. Again, whatever we do on one side, we do on the other. I put my hand here on my leg, keep the fingers together, use that first set of knuckles, and I start going up and down. Now I'm going to go over this wrist, I'm going to go over the back of the hand, I'm going to go over these knuckles and all the way down the fingers, and remember, keep the fingers together. So we're not going real slow here. In a bit we're going to go slow. And you can vary the angle like this, and again, just explore. There's a whole lot to do here. It's not going to be the same for every person, but get to know your body. And so I'm going to go over the top of the hand, and I'm pressing in pretty deeply here, and then over the fingers. And you can go almost the way down, all the way down to the fingernails. And again, keeping my fingers together. Okay, another really good one. What we've been doing is some massage techniques where we go along the body of the muscle. But muscles, what they do is they turn into tendons and then they join on the bone. So you got all these muscles going this way, and you can go up and down working them that way. You can also go cross fiber palpation. And that's especially helpful right at the tendon attachments. So there's a number of different ways you can do it. You can make sort of a claw with your hand like that and go back and forth, or you can just use one finger and going back and forth. Now, one of the good things to do is knowing that there's all these different muscles coming up, and there's a body of the muscle turning into a tendon attachment, and you can find the end of that body of the muscle and where the tendon attachment is joining onto the bone. And again, it's about exploring your own body, becoming aware of your own body. And so then what we're doing is we're just going to go back and forth across the tendon attachment. You could also do it across the body of the muscle. Either the body of the muscle or the tendon attachment. A lot of times when you begin doing this, you'll notice, God, they're kind of like a stiff band. They're really tough. But if you do this once or twice a week for a number of weeks, you're going to notice these tight tendons and these tight muscles that are these really like thick, almost like hard plastic bands are going to become soft. Now, the first time you do this, you may feel like, ooh, that hurts a little bit. Don't press too deep. It's not a matter of how deep you can press, and it's not a matter of being in a hurry to do this therapy or get the problem fixed. So again, you're just becoming aware of your own body. And again, it's another thing to do is shut the eyes and just feel that. And where you find a particular area of sensitivity, gently, just go back and forth across it. And as you're doing this, also station your concentration in that area that you're working on and see if you can soften there, just a mental softening. And if you can take your attention here and be doing this, it actually contributes to the softening on a physical level. And so you can do this in many different places. And again, there's loads of these tendons and muscles. And you might want to get an anatomy book. You don't have to know the names of all the muscles, but see, there's so many of these and where they join on different parts of the muscle, of the bones. And what you can do here is do it, well, you can also do it down here. Now, you can use your fingers to go back and forth across it, or you can use your thumb. And when you find these areas of tightness, you can go back and forth across them, and you can go into them deeply. You could do a circle in either direction. And again, just becoming aware of where you hurt someplace. And so I'm just finding these areas, and a lot of times I'll just explore with my fingers, but then maybe you got a lot of people, they talk about tennis elbow. They play a whole bunch of tennis and it hurts in a certain place. Or people that type a lot, they get carpal tunnel syndrome. Carpal tunnel, what's that? It's something that you can fix. A lot of times people, they'll go to a doctor and a doctor will say, oh, we got to do some surgery. I've had many people come to me that have carpal tunnel syndrome, and I show them these exercises and I say, have the discipline to do this twice a week for a number of months and then come back and see me. And they come back a number of months later and they say, it doesn't hurt anymore. I fixed it and I didn't have to get surgery. I'm not, by saying this, telling you that there's some ailments or some conditions of the fingers, the forearms, and the wrist that you're not going to need surgery for. But what I am saying is there's a whole lot of conditions that if you just take the time to work on yourself, then you're going to be able to fix these problems. So there's another interesting way of doing this, that what I'm going to do is I'm going to get my forearm and I'm going to use my left hand to hold it and really squeeze in, and then I'm going to slowly rotate my forearm. Now, I'm squeezing in with the whole part of my hand. So I'm squeezing in and then I slowly rotate the forearm like that. And you can do that a number of times at that particular place, and then you move your hands down and you do it the same thing again. Now, the direction of the rotation is not important, because I could do it like this and rotate either direction, but we're squeezing in really deeply. Now, one of the last ones is you got two bones here, the radius and the ulna, and they've got an area in between them which we call the interosseous membrane. But what you can do is go in here and squeeze between them. And again, you could shut your eyes and feel, who am I here? What are these two bones? And using the fingers of one hand to really feel in there and see if you can get some separation between the bones and see if there's an area in you that's resisting this, and just try to loosen it up. Again, not being in a hurry. And you can follow this sort of space between the two bones all the way up here. And again, by turning, rotating the wrist, it will, in the forearm, it's going to reveal things to you that you won't find if you keep it in a static position. So by all of this, what I'm saying is explore your wrist and your forearms and your fingers. Get in there and then come to know who you are more. And as you find an area that's tight, and at first you may not find it, but then as you're exploring yourself over a period of a few minutes or a few weeks, you go, oh, I found something. I didn't know it was there. So you put your hands in it and just massage in it really deeply. This isn't this type of massage. It's not like that. It's quite deep. Find where you have some pain. Find where there's some tightness, and then explore it. Go deeply into it and move. And by doing all of these, you're going to bring this tremendous benefit to your forearms, your wrists, and your fingers. And the neat thing about that is then anything you do, typing, playing the violin, playing golf, doing dental surgery, everything, you're going to do it better because the muscles and the tendons in those particular areas are going to be much softer and much more relaxed. And the important thing is do this twice a week. And if you use your arms and your hands a lot, as I do it all the time. And a lot of times when I'm watching TV or talking to a friend, they'll see me. I'm just working on my forearms. And an interesting thing to know about me, and you've been watching me do all of these movements, well, 4 years ago, and maybe you've noticed this in looking at the video, but I've got these long scars here on both wrists. And what is this from? Well, about 4 years ago, I was doing some rock climbing, and I fell off a cliff, and I had about 50 different fractures in these parts of my arms. And yet, they still work really well. This one doesn't supinate quite enough, but if you were to look at my wrist, you'd see these really, really significant scars. And yet by doing these different flexibility exercises I was showing you, these different strength training ones, and this self-therapy, I have brought my wrists and my forearms back to a really amazing state of being able to function even after this extraordinarily hard accident that I had and all the damage that was done. So by saying this to you, I'm indicating that if you've got a problem here, chances are your problem's not going to be as bad as what I had, and you can fix it. Great things you can do if you take the time to work on yourself. This is the last part of this video, Healthy Hands. And what we're going to do here is a few different therapies with hot and cold water. These are especially valuable for people that do a lot of work with their hands. Let's say you're going to do a violin practice and you're going to be on the violin for 3 or 4 hours, or on the piano for 3 or 4 hours, or you're going to do some body work for a number of hours a day. How are we going to protect our hands? What I do when I'm going to do that sort of activity is I'm going to warm up my hands at the beginning of the day. Now, a lot of times you'll hear that expression, warm up the hands, but the hands haven't been really warmed up. People just start using them. But what I'm suggesting is actually warm up the hands. And a really good way to do that is just get in front of a sink and turn the water on. And when you turn this water on, you want it to be warm, and so you start feeling it. And you don't want it to be too warm at the beginning. So I'm just going to start the water on, and now as the water gets warmer and as I do these exercises more, and the exercises I mean is just do what I've shown you in the other parts of the video, but we're going to let the water get warmer and warmer, and at first it's going to be a little hot, so you're just going to adjust to it. And so I'm going to just start doing these various exercises here. It's really not important in what order you do them, but you want to have the warm water going over your hands. And see, now I'm adjusted to that temperature, so I'm going to get it even hotter. And as I'm doing these, I'm just doing all these different exercises. I'm letting that warm water go over all the different parts of my hands. And you'll notice that my hands are starting to get pink. What we're doing is we're getting more blood flow, but that warmth is going deep in. It's not just at the skin level. It's getting the different tendons and ligaments and the joint and the muscles and everything. And as you can see, I'm doing all these different types of movements. And anything that you learned in the first part of the DVD, what you want to do is do those here. And again, the order isn't important, and you want to keep building up the heat. And as your hands get more and more used to the heat of the water, they're just going to get pinker and pinker. And you want to stay under here for like 3, 4, 5 minutes doing it, and especially think about, well, now it's getting really hot. Think about, well, what is the position of my hands that would be in while I'm doing whatever activity I'm doing, and try to duplicate that. Now this water's getting hotter and hotter for me. It's a little bit too hot there. And again, you can see my hands are getting really pink. And you want to, again, keep your hands under here long enough where that heat really starts to go inside of your hands. It's not just at skin level. And so you just keep doing all of these movements here, all of the ones that I showed you in the beginning part of the presentation. And you can put the different joints in traction. You can spread the fingers apart. You can go up and down across the hand. You can massage really deeply along inside of the hand. And again, as I said in other parts of the presentation, I want you to explore your body. Learn things about your body that I haven't even shown you here. And if you take the time, your body's actually going to teach you things. You think, well, I watched this DVD and I've learned all this stuff. Well, if you spend enough time with your body, it's going to begin to teach you things. So now my hands are getting really, really red, and I can feel the warmth inside of my hands. So again, whatever you do, let's say you're going to play the piano during the day, you do this movement under the hot water and really warm up the parts of the hands and the forearms. And you can go all the way down the forearms like this. And again, just massaging them really deeply while you're warming them up. And as you get used to the water, you can put the water on warmer and warmer. And if you put your hands under this water initially, it'd be too hot, but you get used to it. Okay, look at how pink my hands are. Okay, so we've done that about 5 minutes. You'd want to do that at the beginning of the day before you start your work. Then you work all day long, dental surgery, being a sculptor, being a drummer, whatever it is, and at the end of the day you feel, gosh, my hands are kind of tired. So then what I've done is I filled this sink up with water, and I'm going to do sort of an opposite therapy. I got this water, and then I get a lot of ice. And then I'm just going to put that ice in here, filling up the sink, and then I'm going to put my hands in it. And I'm just going to keep them in there and stirring them around. Now it's going to get kind of painful. It's going to get cold. You're really going to feel it. But if you stay in here for just a minute or so, it stops hurting. The hands kind of get adjusted to the cold. They're going to be red again. But what this is going to do is really, really, really relax the hands. It's going to reduce any inflammation. And you'll see the ice cubes will start melting, but the water's going to stay really, really cold. And you just do this. Now it's beginning to hurt my hands. It feels real cold. But if you just stay in here for another minute or so, the pain goes away. Now the pain is going away, and it's not really a very bad pain. And you can look down at your hands, and your hands are actually quite happy with what you're doing. You can put your arms further into the water and let this cold really sink in. That's what's really important. As what we did with the warm water, letting the warmth really go in, let the cold really go in. Now my hands are quite cold, but I don't feel anything. And it's not like I'm hurting myself or getting frostbite, but the cold is really sinking in, reducing the inflammation. So I'd suggest that you do this for 3 or 4 or 5 minutes. And then when you take your hands out, for a while you don't want to do anything with them. You don't want to stress them out, do anything that takes a lot of strength. And again, now the water's really quite cold. You could drink this and it'd be like ice water. And so I'm just moving my hands around, and you can do these exercises in there too. And that's about it. Then you're done. Pull your hands out, dry them off. You've given yourself a really great workout. I taught you those strengthening exercises and those flexibility exercises. So in the morning, even before you do those, you could warm your hands up and then go through all of those exercises and then put your hands in the water here, the cold water here. Or again, at the beginning of the day of using your hands, warm them up, do whatever you do with your hands, and at the end of the day, treat them. It's a great treat. Your hands are going to really, really like this. And if you do this, you're going to notice, if you do all of these things that I've shown you, the warmth, then the exercises during the day, and then this cold, I tell you, in 2 to 3 weeks, you're going to find a cessation of a lot of the problems that you had with your hands. They're going to get stronger, they're going to get more flexible, and it's going to allow you to do that which you want to do even more. So thanks for being with me on this DVD. I've really enjoyed sharing this information with you, and I hope your hands are a lot better after this. Thanks.